My name is David Emerson. I'm a long-term myeloma survivor, myeloma cancer coach, and director of People Beating Cancer. Welcome. This vlog post is discussing response rates. More specifically, the difference between how a response to induction therapy or therapies after your first remission have to do with how they affect your overall response, your overall survival. You might hear your oncologist talk about minimal residual disease or complete remission or very good partial remission or partial remission or remission. The main thing to remember, at least in my opinion, is all myeloma patients want to reach complete remission. We all want to kill the myeloma in our bodies as completely as possible. The issue, again, in my opinion, is what response and that you achieve and how it relates to your overall survival. Further, does it relate to overall survival, and can it relate to your quality of life? And by that I mean, simply, the more chemotherapy you undergo, the greater your risk of side effects. Any of us who've undergone lots and lots of chemo know that it makes us feel awful. And I'm not just talking about short-term adverse effects like nausea or hair falling out. I'm talking about potentially serious long-term or late-stage side effects from blood clots to heart damage. Chemo brain is brain damage, those kinds of things. So, in my opinion and in my studying, my research, the ultimate outcome is undergoing just a little chemo and having a thorough or deep response. By that, there are patients who can reach, after 3 or 4 rounds of induction chemotherapy, can reach minimal residual disease, either positive or negative. That's great. The issue is, will it make them live longer? There is an association with stringent complete response and or minimal residual disease with a longer overall survival. An association, no guarantee. Though there are other people who don't reach complete remission, who live long lives. I think your oncologist will admit, and you should ask him or her, if you can you live a long, happy life with a little bit of myeloma in you? I'm talking about M spikes of less than 1. That's possible. So my point there is your oncologist may push more toxic chemotherapy to reach, in hopes of reaching complete remission. Just balance the toxicity with the response rate. And certainly you might have more questions. Feel free to email me a question or a comment, whether you're about to undergo induction chemotherapy or you're in the midst of it, or you're considering you've come out of remission and you're thinking about XYZ. Email me. I'll reply ASAP. Thank you for your time and effort.